Welcome. Welcome to Science, Health and Healing Encyclopedia of Children's Health Core and Ali Academy. I'm Dr. Majid Ali. The title of this video is Obamacare and the Supreme Court, Part 4. In Parts 1 and 2, I gave you my reasons and my predictions that the Obamacare ruled constitutional by the United States Supreme Court will not lead to any improvement in the American disease maintenance system. In Part 3, in a generic sense, I told you that to improve the results, we as a society will have to learn to keep our bowels open, prevent gut fermentation, and prevent mind fermentation. Now in this fourth part, I'm going to propose something which I know will not be followed, and so the results that I anticipate from this thought experiment will not be realized. Because our society, I do not think, is willing and able to do what is necessary to restore some semblance of health in the citizens of the United States. Briefly, I suggest that every child, teenager, adult, older citizen should be given basic training in breathing out slowly to control heart palpitations, lower blood pressure, cut down spasm and abdominal discomfort, GERD. The second thing that I would suggest would be every person gets some training about these simple, inexpensive oil therapies, castor oil, sesame, mustard, to learn how to manage these ordinary aches and pains, which when ignored can lead to chronic and serious problems. The third thing that I would suggest would be some variation of Dr. Ali's breakfast to prevent dehydration in the morning, prevent sugar roller coasters, prevent insulin and adrenaline roller coasters triggered by sugar roller coasters. For people who are 15 or 20 pounds in excess of their weight, have an insulin test done. Once you know that you have high insulin, you are insulin toxic, Dr. Ali's insulin reduction program 4 or 5 times a week. If we could do these 4 simple things, I believe that we can make a dent. Because years and decades of clinical experience have taught me, first as a surgeon, then as a pathologist, then a nutritionist, clinical ecologist, a person interested in energy healing, that we can make a huge dent. In 2011, United States spent $2.7 trillion in its disease maintenance system. I think if people could get educated about the reality that heart disease is not a plumbing problem, cholesterol is not responsible for heart attacks, there are simple natural things like L-glutamine, passion flower, valerian tea, 5-HT, which can help us cut down the problems of anxiety and sleep, that we could make an enormous difference in reducing the need for drug therapies. I have given you reasons why I do not believe that the insurance reforms are going to make any real difference. I ask you to forward this segment to your YouTube contacts. Our vision is to provide authentic information that is free of cost, free of corporate deceptions, free of ideological distortions. Now I anticipate your question. I anticipate your comment. You're going to say, Dr. Ali, you are a Don Cohete. You're talking about things that you know cannot be done. You have a point. But then what is there for us to lose if we try to spread information like this? Thank you for joining me. Thank you so much.